Good Friday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Today, we are continuing to use our moment of gratitude to thank team members of the KCHD team and our community and governmental partners who are assisting with our pandemic response. Today, we'd like to thank our building operations team. They've provided meaningful contributions in nearly every aspect of our response, from testing assistance to processing all of our supplies that are coming in, to cleaning and disinfecting our building, to keep it safe for all of our team members and clients that come in. We'd also like to thank Knox County Engineering and Public Works for allowing us to use their property to offer drive-through testing. Their willingness to provide assistance has allowed our testing to occur smoothly and efficiently. And we'd also like to thank the many county and city employees who are involved in the response, either in the Joint Information Center or the Emergency Operations Center. This includes the folks from Knox County Health Department, both of the mayor's offices, the library, the district attorney's office, Knox County Emergency Management Agency, and many others. This coordinated effort helps us to be consistent in our messaging and in our response, and we are grateful for all of the work they're doing. Moving on to our local situation. We have 305 confirmed cases of COVID-19 in Knox County. We have no new cases today. While we are very, very pleased to report this, we do want to remind folks that one day is not a trend. Additionally, we have 3 probable cases. 233 of our cases have recovered. 37 individuals have been hospitalized at some point in their illness, and we are thankful that there are currently no Knox County residents that are currently hospitalized with COVID-19. We are also thankful to report that we have no additional deaths due to COVID-19. All right, now that we are halfway through phase 1, we want to talk about some of what we're doing. The benchmark information that we have is updated weekly on our website on Fridays. It is important to note that it's still somewhat early to know if we've seen the full impact of the reopening yet, but so far we are pleased with the progress. We want to start about talking about the qualifications for change in our traffic lights. For the majority of our benchmarks, really what we're looking at when you see things like standard deviation and 14 days rolling mean is we want to see no 3-day statistically significant shifts within a 14-day time period. What that means is every day we look back at the previous 14 days, that's what a rolling mean or average is. And overall, what we mean by this is we're simply trying to see if things are staying the same or are they getting worse? And if so, how much worse? Now, moving on to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. As of today, we meet the qualifications that we have a green traffic light for this benchmark. As we mentioned earlier this week, we are going to be incorporating a way to demonstrate trends in a meaningful way. We are still in the process of making that available, and we are hopeful that we will have that information up for next week. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we're using 2 bar graphs, one that shows tests conducted for Knox County residents and another for average time between the specimen collection date and lab reporting data. Under each of these graphs, and really for all of our metrics, we have drop-down menu that talks about the limitations of this data. For this one, namely those that numbers that do not represent all of the testing, these numbers don't represent all of the testing being performed on Knox County residents. This information should be interpreted as a sample of testing in the community being provided by public health, hospitals, and other medical providers. What we want to see here is that testing is staying the same or going up, and the reporting time is staying the same or decreasing. Based on the qualifications we mentioned for a shift in traffic light colors, this benchmark meets the qualifications for green. On our third benchmark, sustained or increased public health capacity. This chart shows the number of individuals on the epidemiology support team. At 31 people, that is an adequate number to handle the current contact investigation volume, or contact tracing and investigation volume. Under that number is the additional support members that can be activated should case numbers increase. Our teams are designed to be expanded as needs arise, but the upper benchmark estimate of 100 to 100 personnel is not required at this time. This is also based on experience and what our team knows they can handle. Currently, based on our current caseload, the benchmark that meets this qualification is green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the number of COVID positive patients and patients with pending test results in the hospitals. This data is gathered from information put into the hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Tennessee region, or patients from other jurisdictions. These are patients that are in the hospitals in our region. For this benchmark, the traffic light remains green. In full transparency, we did experience a statistically significant increase in the utilization of ICU beds. A 3-day trend of increased ICU beds was detected. However, because this number is so low to begin with, even a small increase registers as statistically significant. In this 14-day period, we had a few days where there were 5 ICU patients out of 272 beds, when the numbers had been much smaller than that, maybe 1 or 2 patients, which is a statistically significant increase, but does not show the whole picture and does not impact the hospital's surge capacity. The decision to keep this traffic light green came after talking with hospital partners and getting their input, as well as taking all of the data into consideration. As a reminder for this benchmark, we always look at the data while communicating with the hospitals who will work with us to assess their healthcare system capacity, which is all stated on our website. Finally, our fifth benchmark, sustained or decreased COVID-related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. Right now, this is the way that we've deemed the most appropriate to represent this information, given the low frequency of COVID-related mortality locally. The metrics for this benchmark may be adapted if COVID-19 related deaths increase. The benchmark remains green because we have not had an increase in deaths. As a reminder, decisions about how to move through the phases or whether to institute mid-phase adjustments will not be made on any one number or figure. Decisions must be made by looking at multiple data points and trends while incorporating public health expertise and developments in science and technology. Those decisions are not made in a vacuum and will be made in collaboration with county and city officials. All of these factors must be considered when determining when and how we'll proceed through the reopening process. As we mentioned, we are pleased with our progress so far and will continue to monitor the data moving forward. And now with that, I'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature now.
That was a lot to take in.
All right, we're waiting on some questions. Okay, from WBLT, the state of Tennessee recently received a grade of F on social distancing. What would you say to those who may be giving up on following social distancing protocol?
We really encourage everybody to still follow the recommendations that we're putting forth with social distancing. That's what's going to help us continue to move forward through this pandemic. We don't want to see a lot of a spike in cases. Everything we're doing is trying to keep things manageable. And so we encourage people, there's an abundance of evidence that staying 6 feet apart, washing your hands frequently, wearing masks when public, cleaning and disinfecting surfaces frequently, and then staying home when you're sick helps to slow the spread of disease. And we want that to continue to happen. Our data so far has been looking good, and we want it to stay that way.
From the Compass, we're 2 weeks into the first phase. Does anything about the case numbers surprise you?
No, not at this point. We've been saying we expect to continue to see increases and we're seeing those. And I think that we're going to continue to respond. But there's nothing been alarming or anything at this point. That's why we said it's still a little early to see if there's been any big trends from the reopening. And we'll be looking into that next week, even more since we'll be out of a full incubation period. But so far things are looking good.
From WBIR, the FDA has now issued a caution about the accuracy of the so-called rapid test produced by Abbott,
Yes.
which is available at clinics here in Knox County.
Yes.
What message, if any, would you have for people thinking of getting that test or who have already gotten that test?
We saw that as well. And what we always recommend and what clinicians do every day is if somebody's presenting and they look like they have COVID-19 and they have the symptoms and the test comes back negative, they're encouraged to do another test and look into that further, and then still treat the patient as if they did have it and give them all the same guidance that they wanted to give. So we don't want to take away the provider's clinical judgment in this situation either. But if there's concerns, that you can always still, again, we talked yesterday that the PCR test, the one where they do the swab in your nose and in your throat, and it takes a little bit longer, is the gold standard in testing at this time.
From WUOT, the medical community is still learning essentials about COVID-19. People may want concrete answers, which simply aren't available right now. How does that complicate your efforts to inform the public, the press, and local government officials? It is hard. And I think we've said it probably in our very first briefing. And I'm glad that you brought that up today. This is an emerging event and things are changing and more information is being gathered every day. And there are huge challenges that come with messaging with that. And so we ask that people expect that there'll be changes and know that. So managing expectations that we're going to learn more. You want us to learn more and you want us to act on what we learn. That's a good thing. And to know that that's expected and should be happening is a good thing. And then just try your best to stay informed. And it's hard, believe me, we're doing it every day, but go to the CDC's website. You can check our data, all of those things to see what the changing information is. And then, you media partners are doing a fabulous job of helping to get out the word on changes that come as well. And we ask that you continue to do that. From WBIR, we realize this weekend's testing at 6 public housing developments is targeted specifically for them, but do you have an estimate of how many people you think you'll be testing? I think the number I heard was around 1,200, but if that's wrong, we'll follow back up. But that was the number that I believe we were planning with. From WATE, yesterday we heard from the health department that antibody tests aren't useful for patient diagnosis. Is there any value to them? And do you feel private providers should still be offering them? Really everything that that's out there right now says that the antibody testing is good for the scientific side. So giving us an idea of disease burden in the community and that type of thing. But nobody right now is recommending that they're used for individual clinical diagnosis, treatment decisions, anything along those lines. Again, it's a changing situation though. So we want to make sure that we're keeping an eye on it. We'll put more information out as it comes. From WBLT, when do you expect the data to show whether reopening Knox County has had a measurable effect on the local case count? Well, we're ending the second week. So we've gone through a full incubation period at this point. So I think next week we would really know, people would have started to see the doctor if they needed to and those types of things. And so we feel more confident looking at next week's data since we're still in an incubation period today. From WBIR, why should customers wear masks? Should businesses require customers to wear masks, or should KPD officers wear masks? The recommendation to wear a mask is that me wearing a mask protects you and you wearing a mask protects me. And that there's plenty of evidence out there now. And again, this is an emerging situation, so it has changed, that there are people that don't have symptoms or aren't showing symptoms that can spread the disease. And so anybody could have it. There's disease in this community, and we are asking that people wear masks to help protect each other. It's really about looking out for your neighbors and your friends and your loved ones and all of those people that may be susceptible to having complications from this, and we don't want to spread it. Also from WBIR, is it required for customers and employees at nail and hair salons to wear masks, or is it optional? In the plan, I believe that it is required in those settings. Their follow-up is, could a salon get in trouble for not requiring mask use?
So again, our first stage always is, and if people are concerned about that, they can let us know, and our team or others will investigate those situations and then educate people. And most of the time, that's the only step that needs to be taken. They act on the education that they're given at this time.
From WUOT, do we have a better idea now of the proportion of Knox County's COVID caseload that are asymptomatic?
I don't have that number in front of me. We could probably get that to you soon. I think we pulled it earlier this week, and I just honestly don't remember what it was off the top of my head, but it was really, our numbers were matching national trends. I can tell you that. So we'll get that information out to you guys next week in our briefing next week.
From WBIR, when should you wear a mask outside? Are there any tips for wearing them outside when it gets hot?
Again, people need to listen to their bodies. So the general guidance is outside, when you're out in public, wearing a mask. And so that's what we want to encourage people to do. Just speaking frankly, when you go out and you're walking in the park and you're away from people and you're not passing people, you don't have to have your mask on your face. I would recommend having it with you so you can put it on if it gets crowded and there's people around. But mask wearing also doesn't negate the need for social distancing. So we still want you to keep that 6 feet between you and other people as well. And that'll help. But in general, when you're out in public, because we are opening up more and more people are getting out, it's going to be harder to keep that 6 feet. And that's why the recommendation is to wear a mask.
From WBLT, is pediatric multi-system inflammatory syndrome something parents should be worried about?
I think there's still a lot to learn about that, and it is very concerning, and there's a lot of researchers and information being gathered on it. And I think, again, with this, everything that we're saying to do is trying to prevent people from getting this illness, and we want to encourage you to continue to do that. So, but it is something that we want to keep an eye on, definitely.
From News Talk 98.7, is today the second consecutive day without new COVID cases?
No, we actually had new COVID cases yesterday, but we transferred some out of our jurisdiction as well. And I think the actual case numbers you can see on our website for new cases. Today's our first day of no new cases.
They also asked, how significant is it that there aren't any new cases?
Again, one day doesn't make a trend. So it's encouraging, but there's a lot of things that could factor into that. So we're happy, but we're very cautious as well.
From WBIR, what testing opportunities will Knox County be offering next week?
As far as I know, the plan for next week should stay the same. We'll let you know if it changes, but Monday, Wednesday, and Friday are our drive-through testing days. And that's really, it helps to conserve PPE, and it helps to limit exposures to both people coming in and our staff. So you call first, 215-5555, and you'll get a block of time for that. Tuesdays and Thursdays are generally when we go out in the public as well, and do those testing for either people who have less access to testing or who are more high risk. And so that's the plan for right now.
From WVLT, how has the number of individuals being tested in Knox County changed over the past week?
It's going up. So, and again, what we see is a sample. We don't have everybody, but from the data that we see, we are seeing more and more people getting tested. And there's a lot of different ways. There's more providers testing. Hospitals are opening up more services, and they're testing before elective procedures and things of that nature. All of that is good, though, because it helps to give us a better picture of what's happening in the community.
Any other questions? Please go ahead and submit them into the chat feature now. All right, since it appears there's no more questions being submitted, we appreciate you all joining us, and we hope you have a great Friday and a great weekend, and we'll talk to you next week.